Hello and welcome to episode 28 of the TMDSAS podcast. Today we have a very special guest, Dr. David Jones. He is Professor Emeritus at the University of Texas Health Science Center San Antonio School of Medicine. He was previously the Dean of Admissions there. If you'll recall, all the way back to episode 1 of the TMDSAS podcast, back when we were talking to Dr. Judy-Ann Calloway, he's kind of a big deal. He's mentored quite a few people in the admissions realm, and we were very honored to be able to have him during our non-traditional applicant series. Before we talk to Dr. Jones, we just wanted to give you a quick update. Here at TMDSAS, we're currently working on applications that were submitted on June 29th, and we are working on all mail that was received in our office August 4th, 2017. Today we're joined by Dr. David Jones. He's a great mentor and a big name here in Texas medical admissions and nationally. And we're really honored for him to be a part of this discussion on helping our non-traditional applicants figure out if this is the right path for them. Dr. Jones, thank you very much for joining us.
I'm very happy to be here. Over the years, we've considered, accepted, and enjoyed the success of many non-traditional applicants to medical school.
Wonderful. Well, first off, for our listeners, let's get them to know you a little bit better. Would you mind telling us a little bit about your academic background?
Sure. My undergraduate degree is from the University of Texas at Austin in the College of Pharmacy. I did a master's degree in pharmacology toxicology, and then my PhD at the School of Medicine in San Antonio. Actually, it was the School of Medicine then. It wasn't the Health Science Center, but ultimately became the Health Science Center. Then I joined the faculty in the Department of Anesthesiology at the medical school with a joint appointment in pharmacology, and way before you were born, and retired this in 2015, and now currently emeritus professor of anesthesiology and adjunct professor of pharmacology. And while I was there, I had the great joy of being a distinguished teaching professor. And also for the last 15 years that I was on faculty, I served as the Senior Associate Dean for Admissions for the School of Medicine. And just to give you a little background, I got into admissions really through my interest in students in general, but in particular, through a project called Project 3000 by 2000, and this will tell you the year that I got involved in 2000. And the idea there was to increase the diversity, the racial diversity of students accepted to medical school. This was actually a nationwide project, and then I used that role as the director of that project to become much more involved in admissions, and then was asked by the dean to be the Dean of Admissions of the medical school. So enjoyed 15 years and continue to enjoy the fruits of the labor in regards to the quality of the young people that have graduated from medical school.
Wonderful. And you also served on the JAM Council for some time there as well, right?
I served on the JAM Council, which was really an offshoot for us in one of the efforts that we were all making in regards to increasing the diversity in our class of students that come from educationally and economically disadvantaged backgrounds. And we were able to take that Texas model and actually develop it into initiatives nationally through the Association of American Medical Colleges.
Fantastic. Thank you very much for sharing that. So let's go ahead and start digging into some of the discussion topics that we have for helping non-traditional applicants. So we've already spoken with Dr. De Olivares, who has kind of given us a quick glimpse into what a non-traditional applicant is going to be facing down the road and preparing for professional school to become a doctor or a veterinarian or a dentist. And so we want to talk to you to kind of get a glimpse into what life looks like for a non-traditional applicant once they get into one of these programs, and hopefully get a little bit of insight into what kind of challenges are ahead and what students can do to prepare to face those challenges.
Well, that's a lot of area to cover in a short period of time. But let me start off by, in my view, defining non-traditional, because that will ultimately influence the answer that I give to you all. We think of a non-traditional student as being older. But what we're finding is that there are many students that choose, and the students call it a gap year. I want you to understand it's not a gap year, it's an enrichment year. And this is an opportunity for you to really gain value out of the year and not use it as a gap. So this then shifts by a couple of years for many students, their application year into medical school. So that student is not very far away from the academic rigors of undergraduate school. Now, having said that, the students that have been away from school for 3 to 5 or more years, in fact, I just noticed at one medical school in the state, an individual 41 years old was accepted to medical school. And during my period of time in San Antonio, the oldest that we accepted was 48. But these individuals face a bit of a challenge in a number of different ways once they're accepted to medical school. Now, mind you, others will probably present to you many of the factors and challenges that the student faces or the applicant faces prior to getting into medical school. But one of the things that we learned in San Antonio about the older students is they have to, again, learn how to study and manage their time. Mm-hmm. And they're managing time in a different way compared to a student that comes right out of an undergraduate program. The older students may well have family responsibilities. They may continue to have work responsibilities. And this is loaded onto the academic demands of medical school. And to understand, there's only 24 hours in a day. And so they probably, as much as anything, the time management aspects is the most critical. And for our medical students that were the non-traditional students, the first semester is a huge challenge because they're not calibrated. And what I mean is they don't know how much to study in order to do well academically. Now, so what I'm saying is it takes a longer period of time for the non-traditional students to adjust to the rigors of medical school compared to the student that's coming right out of undergraduate school. Now, the answer after that is they do fabulous, especially in the clinical years, because now they bring the richness of their life experiences to the clinical setting. And I believe that they are much, I'm not going to say much better clinical medical students, but they bring certainly a new dynamic to the patient-student interaction.
Well, that's quite a bit to take in for a non-traditional applicant, but I think you've touched on a lot of different topics I'd like to dig into a little bit more. In regards to the challenges a non-traditional student faces and not being calibrated to handle the rigors of medical school or even for any professional school, what do you think an applicant can do to kind of show in their application that they are ready for the rigors of medical school, especially if they've been out of school for 3, 4, 5 years?
Well, I will have to tell you, it comes down to commitment. And the commitment is the MCAT score. Mm-hmm. Realize that a non-traditional applicant typically is working, is possibly taking post-baccalaureate coursework, has probably family responsibilities, wants also to gain clinical experiences, whether in dentistry, veterinary medicine, or medicine, and then they're studying for the MCAT. Mm-hmm. And the MCAT is actually obviously very important from the standpoint of predicting how well you're going to do on the United States medical licensure exam, step 1, which is between the second and third year of medical school. And so there are minimums on the MCAT which predict that, number one, that you will ultimately pass the USMLE exam, but then also maybe not pass the exam. So the critical thing is scoring well on the medical college admissions test, which takes an incredible commitment on the part of the applicant, because it's a tough row to hoe, so to speak. Mm-hmm. And commitment means that you're willing to spend the time that it takes to prepare to score well on the MCAT, in addition to all of the other activities that you're involved in. Now, going back to what I mentioned earlier, if you're able to do this, then the admissions committee has a pretty good idea on how well you manage your time. Yes. So again, there's two benefits to that in regards to what an admissions committee might be looking at.
And so digging in kind of one layer deeper beyond MCAT and potentially beyond GPA, what non-academic things can help, or what non-academic experiences can help a non-traditional applicant stand out?
One of the most important aspects of a non-traditional applicant's overall qualifications is how they've made the decision to study this particular pathway. If you just decide you're in business and you don't like what you're doing, and so, I'm going to try medicine. Once you get into medical school and understand what it takes to be successful in medical school, if you're not absolutely, undeniably committed to becoming a physician, then you'll bail. You won't give it your best, and who suffers then? Potentially, if you stay in medical school, who suffers is potentially your patients. So what we look at in regards to, or what we did look at, is what you have turned away from in order to pursue a path in professional schools, and then how you have prepared yourself to make that decision. How solid is your decision? And because we don't want you to simply be really smart, make good grades, have a high MCAT score, get into medical school, and decide, well, it's not for me. And I recall a number of years ago, this is exactly what happened with a student. And the disappointment there is that the student withdrew from medical school 6 weeks in at a time when we couldn't accept another student.
Oof. That's rough. That's definitely a rough scenario for both the student and for the school to leave that spot unfilled. Right. Just kind of to bring this conversation to a close, do you have any additional advice for a non-traditional applicant thinking about pursuing this career?
I think the really important aspect for preparation for application to medical school for a candidate, for a non-traditional student, is to connect with a health professions advisor in some fashion. There are so many different factors that one needs to consider that you clearly may not be aware of. And one of and an individual that can be of great assistance to you is a health professions advisor at a university somewhere where you may be taking post-bac courses or otherwise. These are individuals that are highly knowledgeable of what it takes, and they may not hold your hand, but at least they can give you the guidelines and a pathway where you don't drop into a minefield of errors in how you ultimately construct your application. And the other issue is that they can help you with your letters of recommendation, which tend to be a bit challenging for non-traditional applicants, especially if you've not been in post-baccalaureate coursework. they are the key, I believe, to success. And on the other hand, they can pretty well determine whether you've made the right decision to study a particular pathway in the health professions. So be informed, and the best way to be informed is through the health professions advisor.
Wonderful, wonderful advice. Before we do let you go, we'd like to kind of extend the fun part of these interviews, which is offering you the opportunity to participate in the Mythbuster segment. And so what we do here is we allow our guests to identify a typical myth that they've heard and offer us the correct advice to address that myth. So we'll give you a minute to think about that.
Thinking about a myth. Well, I know one myth that I hear often. People talk about extracurricular activities, and that more is better. But the way that I characterize those is I typically say, don't be a T-shirt getter, because every organization has T-shirts, and all you do is get a T-shirt, but you don't do anything else in the organization. Mm-hmm. And so these are the kinds of activities that you plug in, unplug, and you gain no value from it, nor does the organization or activity that you're involved in. So my advice, and I can tell you our committee continue to discuss this, is get involved in one or two things that you can really contribute to in a substantive way. And this gives you then the opportunity to gain value, but then the organization gains value as well. And you can write about this in regards to your essay. In other words, there may be some particular aspect of it that's really important to you. And that particular activity then really expands your overall qualifications for medical school, because it gives the admissions committee some insight into how you personally value the investment of your time in an activity.
I think that's some really great advice, especially I was guilty of being a T-shirt getter as an undergrad, so that strikes a chord with me. Before we let you go, is there any final advice you'd like to share with applicants?
Well, best wishes to all of the applicants. But I really want you to understand that whatever it is that you're involved in between the years of graduating from undergraduate school and then ultimately applying to medical school, whatever it is that you're involved in, whether you're working or on missions or different sorts of things like that, understand that those life experiences become exceedingly valuable in how you perceive your own personal interactions with individuals around you, but also, more importantly, the patients of the future. It gives you a sensitivity that you might otherwise not gain if you simply just apply right out of undergraduate school. So life experiences are exceedingly valuable to add to the richness of your interaction with your patients.
Dr. Jones, thank you so much for taking the time to share your wisdom with our applicants.
I enjoyed it. Thanks, Enrique.
Thank you very much for listening to this episode of the TMDSAS podcast. We hope you enjoyed this very informational segment with Dr. Jones. Remember to subscribe to the podcast and give us a like. And if you really enjoy the podcast, please leave a review to help other listeners find our podcast a little bit easier. If you're a non-traditional applicant, don't forget that we have a Facebook group set up for you. You can find a link to our Facebook page here in the description of the episode. And on TMDSAS.com, click on the non-traditional applicants banner, and we have a link there leading you to the Facebook group. In this Facebook group, we're actually connecting other non-traditional applicants. Several applicants are currently setting up meetups in their area so that we can build up some great networks locally. And we're currently working on our first live Q&A with our non-traditional applicants in that group. On behalf of everyone here at TMDSAS, we want to wish all of our applicants all the best of luck. And if you have any questions or comments about the podcast, please email us at podcast@tmdsas.com. And don't forget to follow us on social media at facebook.com/TMDSAS. And on Twitter, we're at TMDSAS and at TMDSAS Support. Thanks for listening. We'll talk to you later.